Pwede ho
Sa
bang
akin na lang yung wire.
ma-set up natin? Step in na ako.
Test. Mic test. Magandang umaga po. Ah, may I invite our honorable governors and Congressman Khalid Dimaporo in front so that we can start this session.
Pwede ho bang
Good morning. Let's start. Sige. Can I ask everyone to please settle down? Governor, si Shari Antan at saka si Congressman Khalid.
Check, check.
Sige. While we're waiting for Governor Shari Antan, let me first introduce myself. Ako po si Dr. Timothy Ting. I'm the project director from Zuilig Family Foundation and your moderator for this session. Our session
Check,
today
check,
is
check,
all
check,
about
check.
governors as bridging leaders in achieving better health outcomes for the poor. Earlier, we listened. I was check, check, test, mic. Um, I was told that Miss Peggy Delaney is already here. Let's acknowledge her. So earlier, we have listened to how the Asian Institute of Management and the ZFF used the bridging leadership framework in their work in development. Um, for this session, we will be listening to the experiences of the governors in terms of how they applied the bridging leadership framework in their health systems development, specifically in trying to integrate the health system at the provincial level. So, may I introduce our speakers or our guests for today? Um, from the left is Governor Florencio Joben Miraflores from the province of Aklan. And then Governor J.V. Tyrone Uy from the province of Compostela Valley. Governor Daisy Avance Fuentes from the province of South Cotabato. Uh, well, and Congressman Khalid Dimaporo from the province of Lanao del Norte. Okay. So, can I have? Oh. I have a unique situation because I was trained in bridging leadership at AIM, but I got my field field experiences from ZFF. So I learned bridging leadership from AIM, but I learned how to help others to learn bridging leadership through ZFF. So today we will be with our Governor Shari Antan. Governor Shari Antan de Los Santos from the province of Samar. Let me first introduce the session and the program so that everyone can be on board before we talk to the governors regarding their experiences. The leadership challenge really of the provincial governor is um, poor health outcomes. Um, when we say poor health outcomes, there's a disparity between the health of the poor and the non-poor, the indigenous people and the non-indigenous people, the urban and the rural, the disparities in health. And because the local health system is not responsive to the needs of the people. And also in the Philippines, because of the local government code of RA 7160, it fragmented the health system. The health centers at the municipal level are under the administrative supervision of the mayors, and the hospitals are under the governors, while the medical centers are under the DOH regional offices. So you can see that the system is fragmented, although each one can work well in their areas, but in terms of coordination and integration, it's a really very big problem. And traditionally, when it comes to provincial health leadership, governors really just look at their hospitals because this is what they are administratively linked, and sometimes it becomes an issue during elections or politics. They get criticized for their hospitals. So most governors really look at their hospitals. No? Because of this, nobody is looking at the integration part between the curative, the preventive, the promotive of the entire health system. So this is the leadership challenge of our governors. So this is our theory of change for this uh, program, the Provincial Leadership and Governance Program. In order to have better health equity, there are two major sources of inequity. Number one is the fragmented health system. The second one is the social determinants of health. These are the situations where the person is born, grow, live, work, that actually influences health. So in order to have better health equity, you need to address both. And with the health change model, the driver of the systems change is good leadership. But not just any leadership, because these two things are complex systems. So we need a leadership approach that can address complex systems. So in the program, I'm sorry, in the program, in order to have better health equity, in order to have better health equity, we have to improve the health outcomes of the poor para makahabol, 'di ba? Doon sa So in order to do that, we need to develop good bridging leaders, specifically the governors. We saw the governors as a, a very high leverage point in the provincial health system. So that when the governors become bridging leaders, they gain bridging leadership competencies. They can start to gather the stakeholders to integrate the health system. And they do it through their acts of leadership, specific and collective acts of leadership with their core team. This is what they're going to do under the program. We propose 7 deliverables for the governor, and if they did complete these 7 deliverables, it's a good start in terms of integrating the health system. The 7 are health governance body. So the governor must gather his internal stakeholders together. Number 2, the easiest part is the hospitals, improvement of the hospitals, because it is administratively under them. So they're going to improve their hospitals, ensuring no balance billing for the poor. The difficult part is how to engage the municipal mayors who are in charge of the health centers, the rural health units. How to ensure that there are services and there is no out-of-pocket expenses also for the poor, as also for the transfers. In relation to that, they have to look at the continuity of care. Continuity of care from household to health center, and if the patient needs higher services, then they could flawlessly have just one patient experience. They also have to look at a health information system with an equity lens and community participation, forms of participation for their governance, and lastly is an integrated approach to social determinants of health. Later, we will listen to Governor Daisy Fuentes and Shari Antan on how they integrated the social determinants into their actual health interventions. So these are the 7 deliverables, and hopefully governors as bridging leaders as provincial health champions. So, sorry. In November 2016, we started the program with them together with the help of DOH regional directors. So this is November 2016, and after 2 years, this is I Professor Garela already has presented this, but basically 33% reduction in maternal deaths, 25% reduction in infant deaths as a cohort, which translates to MMR of 79 to 52 and IMR of 5.7 to 4.3. But the verdict is, the jury is still out. So we're going to look at 2018 data and 2019 data. How were the governors able to produce these results together with their core teams? Maybe that's the most important question, and that's what we're going to have this session for today. Uh, eh, we've seen this before. This is scorecard, which acts of leadership. But I want to center on financing because one of the box there is all about no balance billing for the poor. So when the poor go to the hospitals, when when you ask the poor to come up with money to pay for their care, it automatically translates to catastrophic health expenditure. So they sell their land, they sell their carabaos, they sell. So we don't want that to happen because it deepens, it pushes the poor deeper into poverty. So no balance billing is one of the focus areas that the governors look at in order to really look after the poor. And this is the no balance billing status of our governors, our provinces, and the green line is the national average for 2017. So more or less, many of them really did well in terms of ensuring that the poor are taken care of and there is no catastrophic health expenditure. This is the runway. This is the runway. So Module 1 is about grounding and visioning. Module 2 is about adaptive leadership or learning co-ownership. In grounding and visioning, these are what they go through, but we will be focusing on only several portions of this. So in grounding and visioning, we will be focusing on their deep dive experience, and in co-ownership, we will be focusing on internal core group and how do they engage their external stakeholders. And later on, for co-creation, we will be talking about social innovation and responsiveness. Okay, so let's start. Ownership, this is all about understanding the self in relation to the nature of the health inequity. So this is about personal values, personal vision, and we designed an activity. It's called a deep dive activity, wherein the people, the governors, the leaders go and experience the system itself. So this is Governor Miraflores. He and then Governor Daisy Fuentes in the IP community, and Governor Shari Antan in Barangay Camarabuan. So yes, let's start. Uh, Governor Miraflores. This is, by the way, the format is an open format, so anybody can join into the conversation. But Governor Miraflores, would you like to tell us about your insights and learnings during your deep dive?
Okay, thank you, Doc Tim. Uh, when I joined this program under the Schwelig Family Foundation, actually, health has always been a priority on my part. When I became governor, I poured resources in our hospital system, added personnel, equipments. But I found out that even if I poured resources to my provincial hospital, it still became overcrowded. People were still complaining, and problems cropped up time and again. So when this PLGP program under Swelling Foundation was introduced to me, I joined it, and one of the first activity was the deep dive, which I did in one of our farthest barangays in Aklan. And in that deep dive, I interviewed a husband whose wife died during childbirth. And it was a revelation because he was telling me that the wife died because first, she was not given proper care during her prenatal consultations with the rural health unit. So she decided to give birth at home because of that. And when she did the childbirth at home, because it was a complicated pregnancy already, she bled, and when she started or when she went to our municipal hospital, since our municipal hospital in that town was an outpatient hospital only, and it was already midnight, so there was no doctor present. So when they decided to bring the wife to the provincial hospital, she died on the way. So I realized that there was something wrong. There was a wrong in the system that we have been uh, doing our health system, because that death could have been prevented if the system worked. And so when I realized that, I talked to my people, and I decided that one of my mistakes was concentration on the provincial hospital without developing my peripheral hospitals, the municipal hospital and the district hospital. And with that realization, I started to develop or to improve our municipal and district hospitals to become not only outpatient but infirmaries. And also, I realized that I have also to work with rural health units to be able to get them on board, to get them into the system, so that that kind of death will not happen again in the future.
Thank you, Governor. Governor Daisy, would you like to jump in regarding your deep dive experience? What did you learn or your insights?
Um, when we deep dive in one sitio of Kimato, that's a mining tribal sitio. I asked the mother of a undernourished child who cannot walk. I said, what was government's intervention in your case? And she told me, except for the nutrition officers, she cannot remember anything that the provincial government did for them. She knew their barangay health workers, their barangay captains, and nobody else. But she's still happy with life. And I said, why is it that this is all farm and you're not planting, vegetables, etc.? Are we not giving you seeds? And he said, Ma'am, are you aware? Because she doesn't know I'm the governor. Are you aware? And that's very insulting. I've been there for 30 years and they do not know my face. Then I said, do you know that the rat infestation in the mountainside is all season now? We cannot plant anything. They eat it. Even the coconut shoots, they eat it. So we have, you have given us poison. Government has given us how to poison them. You notice all the herbal plants planted around. That's to discourage the rat. But it never did. My husband earned only 200 pesos, and they were very fortunate, a week, and I have 3 children. So when I went home, I asked my people, but I asked them, how about your health workers? Are they here? They are visiting us. That's why they are very clean. There's even material segregation, a waste segregation in that mountainside. It means that our clean and green program are very effective. And they said, we have health center. Why are you not availing them? He said, we have to pay 35 pesos to ride in a habal-habal just to reach the health station. Are they treating you well there? Yes, they're very kind. But we have such cultural beliefs that it's only a member of the family that should see us when we're giving birth. And we thought everybody, has been acclimatized to or open to going to the health centers or giving birth to a birthing station. So I see cultural obstacle that we never took seriously before that. We thought everybody's educated, everybody has accepted the way of life. Second, I never thought that my people are so poor that they cannot pay even money just to go down to the health station. Third, I was happy that our health stations are functional, even in the very, very isolated areas. And third, that they never knew that their provincial government is part of the whole public health program. So when I came back, I said to my integrated public health people, what do you expect? What are we doing in public health? Because we have to talk about nutrition. Why are our nutrition people not going there? But they were there, right? Why are we not talking about agriculture, helping them with their problem that they cannot farm their farms? Uh, Third, we have not given incentive for them to come down to the health station or use our tribal people that are educated to campaign and be open to give birth in the health station. And so I asked myself, what do I understand of public health? Well, public health is about vaccination. That's what I understand. I'm just worried about my hospital. So when after that, we ask ourselves, how do we become relevant if our municipality mayors don't even understand the need for really serving the farthest and the needy when our nutrition people are not even coming in or solving the poverty there. So what we did is we make up a convergence team because I then realized that public health is very necessary if we don't have to clog our hospitals with patients. That nutrition is very necessary, that cleanliness is very necessary, but it is also necessary that people must have income. Okay? So what we did is we form a convergence team. Not only us in the provincial level, but the municipal level and the villagers themselves. And we decided that convergence of delivery of services and competencies and education must be done at the sitio or community level, not only at the top. So that's my realization.
Thank you, Governor. Governor Tan.
Well, I was elected for my first term as governor way back 2010. And at that time, we were bombarded by issues about the bad situation of the hospital. So when I sat as governor, I really focused on the hospital. And at that time, that was the program that is very close to my heart since I'm a pharmacist by profession. So I focus on the curative aspect because I'm not that confident to ask my mayors to somehow develop or do something with their RHUs. Baka sabihin nila, hindi mo pa naayos yung hospital mo, bakit kami, you're insisting to ayusin yung RHU. So, I took that as a challenge. And gladly, for 3 to 4 years, we did an improvement to the hospital. Then, way back 2013, after Yolanda, we had this concept of rebranding the province. So we hired a consultant and we came up with a Spark Samar. And soon, it became Spark Samar Development Agenda. But the problem is, how can I integrate the different problems or the different programs of the province? So I'm looking for somebody or a special program that somehow can guide me or help me in integrating the different programs of the province. And somehow being a middleman or the third party to have um, I don't know if it's alibi or if it's an instrument to access the mayors. Because at that time, majority of the mayors are not mine. So I need to somehow ligaw just to get them. So when Professor Garilao and of course you, Doc Tim, went to my office and asked if I can be engaged with the Zwillig Family Foundation for the bridging leadership, I immediately said yes. And then during that discussion, you informed me, Doc, that there should be a deep dive. When I asked about deep dive, I said, Doc, I'm doing that every day because I used to go to the different barangays, and even I used to have this Farmers and Fisher Folks Congress every year just to get a parallel information not only from the barangay and the mayors but also from the sectoral side. So meron na kaming inaayos. Now why should I go to the deep dive again? So you just said it. No, Governor, that's a must because that's part of the module. So I
What
have
did
to
you
be
learn, Governor,
there.
dun sa deep dive?
Okay. So when I went there, the mother of the malnourished child, when she saw me, she immediately cried. I don't know why. So she immediately cried, and then she said, Gov, thank you for coming. And she's holding the child, although the the house is somehow okay compared to the other one that we went, that picture, with nothing at all.
A 4-year-old child, this
Yes,
small.
yes. So at that time when I asked what's the work of your husband, she said he's a farmer, but it's a farm worker with a small income. So at that time, when we're asking, actually, you're always reminding me at that time, Go, please don't give solution. You're here to ask, not to give solutions.
Understand.
Yeah, so we can understand. So when we went back in the car and we rode, di ba, nag-drive na tayo pa uwi, I realized that first, the problem is interconnected. There should be a systematic approach to development. That means health is dependent to education, education is dependent to peace and order, even to the livelihood, and it's a complete cycle. And second, I cannot do this alone. So I need somebody to help me, to assist, and even to be partner with us. So that's a time that I consider talking with the mayors, talking with the BHWs, because at that time we had with us the BHW, and she had that command over the family. So I said, the BHW is more influential than me. So I think we can also access the strength of the BHW. So the realization there is, well, if I cannot do this alone, then I need somebody who can help me to address the problem.
Thank
Thank
you,
you.
Governor. Congressman Dimaporo, um, y- Congressman Dimaporo is a fellow from the AIM program, which he took in 2008 and 2010. So basically, he was the first governor to be formally trained in bridging leadership. And based on what I've read on the case that was written about you, you also went around the barangays and you tried to assess their needs. Would you like to tell us more about that?
Well, let me put it this way. Unfortunately, we didn't have your expertise. So when Prof. Garilao brought our cohort, we didn't have a deep dive. Instead, we had a baptism by fire. You know, they closed us all in one retreat, and Prof. Garilao basically said, "Okay, you guys will be bridging leaders, and we want you to identify your social divide." My social divide was simple. It was rooted on conflict because Lanao del Norte, my province, erupts all-out war against the MILF. MOA AD against the MILF all started in the province of Lanao del Norte. So my divide was that. There's an inequity between the Muslim communities and the Christian communities. And that inequity is basically poverty. The Muslims live in the interior, 80% poverty level on average. Christians live in the coastal, 40% poverty on average. So the Muslims look down at the Christians saying, you have better lives than we do. That's why we are again angry at the government. That's why we feel neglected. And in that retreat, that's when I identified healthcare as one of the mediums to address social inequity. So that was my baptism by fire. We identified what we needed to do in that retreat and then went back to the province, and we had to give Professor Garilao our deliverables. So that was a different system back then. In the 2007 to 2010 administration, that was GMA, we didn't have the support from the Aquino administration. If you remember the PhilHealth cards, the indigents couldn't get PhilHealth cards unless you are sponsored by a mayor, sponsored by a governor, or sponsored by the congressman. I'd like to thank Professor Garilao because we in Lanao del Norte accomplished the universal health care program before the Aquino administration in the provincial level. We went around the barangays and we said, walang pamulitika, there's no politics. Just as long as you're an indigent, it is my job, it is my duty as a provincial governor to give you a PhilHealth card. And people were happy about that. That was one of, surprisingly happy because the congressman lost and you had about 60,000 beneficiaries with no sponsor. And now they finally have a sponsor. They're not ashamed to ask me a card because they didn't vote for me. So that was one of the biggest divides. Second, I looked at the province, and we only have 3 functional hospitals. And to cover all four corners of our province, I needed to put up 3 more hospitals. Within 2 years, under the Bridging Leadership Program, we put up 2 more hospitals. Total of 3 more hospitals. Total of 6 provincial hospitals that we fully funded. That was during the AIM Bridging Leadership Program, and then Zweli came in. Now, when Zweli came in, I already started and completed my healthcare reform program with Professor Garilao. I passed, so hopefully I did a good job. When Zweli came in, the next question was were we able to sustain it? Because as a bridging leader, we're not health officers, we're provincial governors. Healthcare is one of the many problems in the province. I was working on different things. And Zweli came in with a scorecard. And then that's the perfect time. That was about my last term, 2000, if I'm not mistaken, 13 to 16. 13 to 16. So the scorecard came in. And that was the test. Did we sustain what we started back in 2007? And what was nice is when I saw the scorecard, it wasn't as bad as the reds that I saw kanina. With a few reds. And when I asked the provincial, the chief of hospitals, why do you guys have reds with all the support that I'm giving you? And then their answer to me is, Gob, these Israeli guys, they're very, with paperwork, so we'll
Makulit.
catch up. We'll
Makulit.
catch up. We'll catch up. We have you're not giving us enough staffing support also. But anyways, eventually we improved the scorecard. And I was able to see that we did sustain the program. I guess the reason why I'm here now today, as the only congressman among the governors, is it's actually the question that I asked Professor Garilao when he first introduced bridging leadership to me. He was former secretary of DAR, and I asked him point blank, well, if this bridging leadership is useful, did all of the transformations that you did in DAR, was it sustained when you left as secretary? No? And that really is the big question that I have. I've created a healthcare reform program. I've more or less guided it, incubated it as governor for 9 years of my life. And now I'm sitting as the congressional representative. Will it survive with me gone as the governor? And that's more or less my story in a nutshell.
Thank you, Governor. Governor Tyron, would you like to tell us what did you learn during your deep dive, or what did you realize?
Well, in a deep dive situation kasi, we were immersed to communities, really to the household level. So you learn how to appreciate the realities of life. We learn how to empathize. As leaders kasi, we must be able to empathize our constituents' lifestyle, no? So that we'll know how to help them or what system is lacking. So I realized that the government has a lot to do. No, when we deep dive in a place where malayo konti and malayo sa mga barangay health station, lalo na sa hospital. So we realized the problem that was set by Gov Daisy, the distance also was considered, and also the information, no, na merong barangay health station doon was really challenged, no. So medyo uh, I realized that kailangan talaga may sistema ang government when it comes to bringing or delivering the health system or the health services that that is needed, no, sa mga constituents natin. So really yung mga realizations natin ng mga governors na it needs the collaboration of the community, the government, the even the private sector to really effect change, no, doon sa baba.
Thank you, Governor. Actually, we were given more time for this part. Can I ask anybody, any of the governors, did it really, how did it change um, the way you see the situation when you started to listen to the stakeholders?
Um, I said before, public health, I thought it's only vaccination. Now I understand that you have to start, parang it's a service delivery network. You have to establish the flow from the community, individual family, up to the provincial level. Paano siya nagtatahi-tahi? Sa lahat ng problema, may sumasagot ba? May tatakbuhan ba yung tao?
And being able to listen
And
really
to
helped.
listen to. So ang dami, it's really complicated. Meron kami na mayor na walang pakialam. Pero kasi we adopted the local scorecard ng health in planning. And so we see that hindi sila nagbibigay ng MOE. And you know, rural health unit, our BNS cannot function if they don't have the wherewithal. Maliit ang perang binibigay doon. So anong gagawin namin? So we tap budget officers, treasurers to meet, and on their own, can they add money, and will the SB adapt it? Or if it needs mayor's intervention kasi you really have to sacrifice something to put money, then it's my job to influence the politicians, di ba? So, ngayon meron naman palang away yung rural health unit ko na mga doctors, tsaka provincial health unit ko, tsaka region ko, may away na naman pala. So nag-intervene ka na naman as a politician, di ba? Iyon kasi ang power ng governor. You can intervene. So kung yung mayor ko soft, doon kami lumalapit. At may nakita namin kaya niya mag-influence ng lahat, doon kami lumalapit. Pag hindi doon kami sa career mismo, they can influence the mayor. Supposing I have 3 mayors who don't belong to my party. Of course, hindi ako makalapit doon. Kung lalapit man ako, hindi sila makikinig. So what we did is, we asked, sinong health doctor nila? Ito, bakit yung appoint yan, malapit yan sa kanya, Gov? So I went through that doctor. Na ikumbinsin mo si Mayor, itong programa natin, kaya mong kumbinsin Mayor mo na magdagdag. O ako nang bahala dyan, Gov. So slowly ngayon, the service delivery network namin is not only in health, it's almost on everything. Ang nangyari sa bridging leadership, it's not compartmentalized. If improve your totality as an administrator of the province, it makes you understand the gaps. So yun ang pinakamaganda kasi it's a continuing growth for all of us. Kasi along the way, na-install mo na to, along the way, kailangan mo baguhin mo dyan, and I think it's right, that's why I really recommended, para mas mabilis yung effect, is for you now to work with governors rather than mayors, kasi tagpi-tagpi. So, governors, you work with governors under IPHO, and I think yun isang realization. Then everything we do, we put an ordinance to it so that it will be institutionalized. Hindi na pag alis mo, wala na. So ang tanong nun, can it be sustained? Gov, ito lang yung akin dyan sa sustainability. Wala naman talagang 100% assurance. But then we have already raised the level of people's expectation. We have raised the level of efficiency of our career people. And because of that, whoever comes after us has to be confronted with that raised awareness and conviction. Di ba? So, medyo mataas na yung expectation. Hope natin, sakyat sila, mas magiging better ka sa atin.
Thank you. Um, because of time, we have to go to co-ownership, no? Governor Miraflores. Can you tell us about your team, your internal stakeholders? I've heard about Team Tambayong.
Yes, that's a local term for bayanihan. And after that deep dive and realization about the problems that we were facing, where there was a fragmented health system already, we formed a core team, and this is composed of my chief of hospitals and also involving my local finance committee so that there will be the response time would be very fast if there are requests for MOE or equipments. And also, we expanded the provincial health board. I realized that in order to have the municipal mayors and the municipal health officers to be on board, they should be part of the provincial health board. So I did an executive order which expanded and put them to all together. And this is the first time actually that this ever happened. That in one setting, you have the provincial health officer, the chief of hospitals, and the municipal health officers. Why the municipal health officers and not the mayors? Mayors are also very busy, and sometimes health is not their real priority. So we work with the municipal health officers, and in that forum, we now realize that we had to fix many things in the system. There was a sharing of ideas. Uh, it was also a revelation on my part because these municipal health officers sometimes are not in good terms with their mayors, so they shared their experiences with me, and it's now up to me to discuss to the mayors that you have to also work together so that we can have a better health system. And in that forum, in those meetings, because of shared with them my experience in the deep dive, wherein one old lady in that dialogue that I did complained to me, not really complained, but gave me her experience when she was visiting a health facility, and it was very revealing because she said, Governor, the problem is when we go to the health office or the hospital, when the health practitioners see that we are in our slippers and muddied feet, they don't
Pinapansin.
hindi kami pinapansin. They don't take care of us. So with that realization, we also developed and we partnered with DSWD that we would like, I told them that we would like to target the real poor. And how to do this? The DSWD has a system of the National Health Targeting System,
NHTS.
NHTS, and identifying those poor. We now decided that they should be given VIP treatment when they enter the hospital. And how do we do this? We now partnered with Paymaya. We have Paymaya cards. We give them Paymaya cards. We call that the family medical service cards. And in that card, they will be identified immediately after they enter the hospital or the rural health unit. They will now be identified as the most needy. So with that card, they will be given VIP treatment, and also immediately they can access a maximum of 5,000 pesos in terms of laboratory, in terms of medicines, because as you know, when people get sick, when they go to the hospitals, they don't really have the money to pay for the emergency drugs. So
To ensure that the poor do not
they
pay
not
out of
pay
pocket.
out of pocket, and we're now going to the no billing, no balance billing, and that is why that is a challenge for us now, how to be able to really identify, and we have that already. Actually, we have identified 180,000 poor families in my
Times
province
5,000 pesos.
times 5,000 pesos every time they enter a health facility. So that is what we did to involve other stakeholders. the MHOs, the DSWD, and the communities to be together in delivering a better health system.
Thank you, Governor. You with Governor Miraflores, he was talking about his internal stakeholders, with his core team and with his provincial people. Now let's go to Governor JV Tyron Uy about the external. How did you engage the external stakeholders? You had a story that you had difficulty with accessing funds for nutrition.
Yes, no. Just like what Governor Miraflores, we also created the PLGP core group, no. So the PLGP core group then was created through an ordinance. No, through executive order also. And we were tested by a very daunting task, no, because we created this end hunger chain of programs because we prioritize nutrition in our province. We had a partnership with DepEd and Gawad Kalinga, wherein we set up central kitchens around the province, all municipalities. We have 11 municipalities. We set up 14 central kitchens. And DepEd sana yung mag-provide ng funds for the procurement of food, no, para sa school-based feeding program namin. And we provided for the logistics and the all the renovations ng mga kitchens, no. Ang problema that time was I think last year August I was informed that the DepEd funds that was intended for the 9,989 students, undernourished students, was trimmed down, no, from 21 million down to 9 million. So we lacked 12 million funds for the undernourished kids that we were supposed to feed, no,
Paano nyo
during a
i-
120 days
so
feeding
how did
program.
you apply your bridging leadership competencies?
So yun, I thought, of course, there was an initial meeting with the mayors uh, during the part of the formation of the core group, but then we met again because we had this problem. So sinabihan ko sila na kung hindi natin ma-raise itong amount na another 12 million, more than 5,000 of our students will be neglected, no. And hindi naman pwede yan, makukonsensya tayo yan. So we must do something together. So yun, nag-pledge sila, no. First thing, ang mayors nag-pledge sila na tutulong sila when it comes to funding ng mga pagkain sa 120 days feeding program. They siguro mga 20% o 20% yung sa kulang per municipality yung na-commit nila. But then 80% kulang pa rin. So I had to seek advice to my dad, no, former governor, because magaling siya dyan about bayanihan. He's been there for the last 9 years. Classmate yan sila ni Gov Khalid when he was the governor also. So, dumaan din siya sa Bridging Leadership by the Zwellig Foundation. So, I asked help, paano natin gawin ito because of the amount needed. So, may brilliant idea kami na engage natin yung external stakeholders natin, mga miners, kasi we are a province rich in gold also, no. So maraming nagbimina, mga quarry operators kasi tayo naman nagbibigay ng mga permit sa kanila sa probinsya, mga suppliers natin, no, sa mga contractors also. We sought help from the DPWH and we presented the problem, no. If hindi natin ito mapakain itong mga bata, what will happen to their lives? No. What will happen? My concern is anong maging performance nila sa eskwelahan kung walang laman yung tiyan nila. And yung suggestion nga sa akin, the first suggestion from the group was, unahin na lang natin yung severely wasted. Yung wasted, yan na muna. Di ba? Makukonsensya naman tayo. So, luckily, sa series of consultation and partners forum, with the different stakeholders, they bought in to our idea and help, and in fact, uh, more than pa sa needed yung na-raise namin that time. Series of partners forum, 1 month yun na engagement with the external stakeholders. Thanks to the
Governor, what did
opportunity.
you learn doon sa experience mo na yon regarding multi-stakeholders?
I learned that if people or the stakeholder will just know about the problem and uh, somewhat uh, una, of course, they have to trust you, and of course, they have to trust the program, and then they have to see the whole concept of the program that will be implemented by the government. Wala namang problema. Bale, they will just buy into your idea.
Thank you, Governor. Before we go to co-creation, let me ask Governor Khalid, because Governor Khalid during his time, he worked with also with the SCORE group, and ang sabi dun sa article is, I have to learn together with my team, and you also did your health summit, which really opened your eyes about the needs of the people. Can you tell us more?
Yeah, my background was an economist. I didn't work in government. Before I ran for governor, I was working on my PhD in Texas A&M until my father called me back home. So I knew really nothing about healthcare. And then I jumped into this bridging leadership program. Within 2 years, and my core group, I think I can debate, or I'm as aware with healthcare as any regional director in DOH. Because I know all our problems. So that's basically it. What bridging leadership did was, one, form a core group. Once we form the core group within the capital, within the provincial capital, then we can start to um, find synergy by replicating with the other departments and working together towards a common vision. But what was interesting was outside the capital. The capital was natural. I'm the governor, I'm the boss, you have to follow me. Outside the capital is different. And you have to remember, in 2007, it was a different healthcare environment, health industry environment. When I declared the provincial hospitals as a public enterprise, the private hospitals were up in arms. You know, to the point that our doctors, our chief of hospital, and the private hospitals were friends. If we were lacking in fluids or in meds, they will share. But no, they were up in arms. No, kalaban na kayo. You are a competition because you're declared as a public enterprise. The private hospitals. And then the RHUs. And the DOH knows this. Municipal health officers knows this. During 2007 to 2010, once you get, or your municipal mayor gets, a big sponsorship for PhilHealth cards, you get back the amount from the government to your RHU in form of capitation fund. So when the PhilHealth cards were absorbed by the provincial government, then the capitation fund is no longer with the RHUs. It's with the provincial government. They were all up in arms. Up in arms. So we had this multi-stakeholder forum to create co-ownership. And I kindly, gently, I had to deliver within 2 years to Professor Garilao, kindly, gently said, the last thing you want me to do as a provincial governor is not to believe in healthcare reform anymore. Because you, the private hospitals, I want you to all make millions. Who are going to your hospitals now? It's the indigents that I'm sponsoring. I don't meddle with that like other provinces that they say, oh, PhilHealth card valid only for provincial hospitals. This is for everybody. RHUs. If I will not spend for this, you ask your mayor to spend for those provincial PhilHealth cards. All the mayors, of course, will say, I don't have to spend 10 million for my supporters. Gob Khalid will spend 10 million for my supporters. You talk to your mayor. But whatever you need in the RHU, you can count on the provincial government. What I don't like is when there are funds wasted. And I don't like the capitation fund being divided as another form of allowance. We will provide you medicines and supplies. That's what we will give you. So we find common ground. Yes, when you start change, there's resistance. But when we create co-ownership, we have to find common ground because this is our job as public servants. We have to provide health care delivery to our constituents. And we should not fail in this. And thankfully, they all agreed. And I was again able to pass that program. We came again. The second time that I did a multi-stakeholder forum was with Zuelig. That was a little bit scarier because I did not have control. I did not have control. Prof. Gary Lau likes to talk about Mayor Sonia. Mayors are different from governors. When you're talking about the municipal healthcare program, that's you can control the barangay. But in the level of provincial governor, just like what Daisy said, it's so difficult. Because what happens if one mayor, two mayors, three mayors doesn't want to do the healthcare program? They don't care about healthcare. Then you're going to have a bungi system, holes in your healthcare system. How do you address that? It was just timing during that time that the Aquino administration had I coined this as reverse devolution. Reverse devolution. So the mayors that were not interested in healthcare, they provide them. They don't have municipal health officers. They provide them with doctor to the barrios. The mayors that don't have RHUs, then you have the HFEP program, where the RHUs were brand new and very nice under the Aquino administration. The mayors that don't have nurses, they provide them with NARS program, all funded by the national government. So it was timing when Zuelig came in that we were able to synergize in the provincial level a common direction. And that was to put an end or to target zero infant mortality and maternal mortality. When I start with Professor Gary Lau, it's a non-existing healthcare system to an existing healthcare system. And then when Zuelig came in, we're looking now for delivery outcomes, maternal mortality and infant mortality. And we were able to do that with our stakeholders.
Thank you, Congressman Khalid. One more question before we go to co-creation. Governors, tell me, in terms of co-ownership, about, in a way, sharing power, sharing decision-making power with your stakeholders.
I'm fortunate because ever since the civil society and the private sector sits and are sectoral chiefs of our provincial development council, they comprises 48% of our PDC. So when we created a convergence team, they were there, and we already have a list of their expertise. So when we decided to pilot convergence programs in far-flung situs, in the urban center, but yet poor, then we called for them. And so we presented the problem as usual. Then they have commitments. But I created an office that will monitor the commitments. So every month we have a meeting para alam mo kung sino yung nangako pero hindi nagdi-deliver at bakit, no? So because of that, yung aming trabaho talagang may scorecard kami.
So, Governor, you were sharing the
Yeah,
decision-making
yes, I don't
power,
decide.
pero minomonitor.
Minomonitor ko. Itong problema, sila rin ang nagsabi, nag-agree kami, ito ang gagawin natin. Kanino to nakatoka? Akin yan. Sabi ng isa, di ba? So yung kanilang commitment, minomonitor ko. At nagmi-meeting kami. Itong problema, medyo mahina dito, what can we do? So it's so that parang hindi kami maubusan ng panahon. I created a unit precisely for this convergence experiment. So now we are expanding. And now our municipalities are getting involved. So medyo mahirap siya pero they're now getting involved. In fact, last week for the first time, kasi 'di ba ang province ko medyo naman sa Region 12 awardee kami palagi sa health, etc. So ang ginawa namin, we created a day where the scorecards may award. At saka hindi simpleng affair. Sa napaka-grand na lugar, naka-gown yung mga tao. mula sa barangay at saka etc. And I was wondering, mas fashionable pala sila ka sa akin kasi mas grabe sila. And then we have it covered. Parang awarding of good performance. Sinong pinaka naka-reach ng 1% drug blood donation, voluntary. Sinong nag-increase ang MOA support na town? Sino yung pinakamagaling na private hospital na tumulong sa amin? Sinong NGO nag etc. So we awarded that. And I think in this case, it's hindi naman lahat ng dunong alam mo na gobernador. You have to involve them kasi mga expert din sila sa kanilang mga field. And then, at the end of the day, ensure lang na merong decision at toka. At ensure na merong monitoring. Kasi kung walang monitoring and evaluation na regular, kwento lang. Walang nangyayari. So, yun ang ginawa namin. And then, siguro Pinoy tayo, shame game really an awarding, really awarding of good work really make people very enthusiastic in helping out. And we make a grand affair of that covered by television and local media para naman yung mga mayors na palaging kulilat
So
mahiya
Governor,
naman.
you weren't uncomfortable about sharing the decision making power.
In fact, ang tingin ko kasi enabler lang kami. Ibig sabihin, we bring together people, facilitative lang kami. Ang papel lang talaga namin is to ensure na yung naagrihan ng lahat na course of action at programs, schedules of implementation is done. Yun ang papel ko as a governor. Para sa akin, it will be very, very easy pag gumawa ka nun kasi ikaw lang lahat. Mabigat yun para sa gobernador.
Thank you, Governor. Um, can we go to co-creation? Let's go to co-creation. This one. Now, co-creation is all about social innovations, new institutional arrangements. No? How do we transform the institutions so that it can produce programs that are responsive to the needs of the people? So, and I've highlighted participatory governance and also responsiveness. No? So, Governor Shari Antan, would you like to tell us more about Spark Samar, specifically your work with the People's Organization?
Yes. When we had this program for the Spark Summer, actually hindi sila sanay. They're not used to it because um, yung mga tao namin, sanay sila dun sa the typical government programs. But during my time, sinabihan ko na sila, oops, bata yung governor nyo, hindi matanda. So expect that there will be innovation. And then, after a series of meetings with the core group, we realized that we need to come up with people's organization na parang naka-cluster-cluster siya. Just like siguro in Mindanao, that there will be parang mga peace village or the women's peace table. It's like that. So same with us, we also did some innovation for our tourism. So we form a clustering, and then we did this Tandaya Trail under Spark Summer, and then that created PO. We trained them, we enabled them, binigyan namin sila ng capability building. And then later part, we observed that they are empowered. And it's easier for us to work.
Governor, kasama rin ba sila sa decision-making skill?
Yes, talagang we invited them kung ano yung mga kailangan. Just like before, when we give them instructions and we give them yung mga trainings, skills trainings, dati parang what's in it for us? Ako, 'di ba? Anong pwede sa akin? Mahirap ako. Kawawa ako, parang ganun parate. But then later part, I was really overwhelmed with the question when they ask us, Gov, nung lumapit sila, yung isang member ng PO, Governor, can we ask additional fund? So sabi ko, naku, hihingi na naman to ng kung ano-ano. Di sabi niya, but Gov, we want a training. Sabi ko, oh, what kind of training? We would like to come up with the, yung sa accounting. How to yung
Keeping,
bookkeeping.
bookkeeping.
Yes, oo. So sabi ko, why? Do you have enough money? Because you want to have that accounting na eh. Yeah, Governor, because before we're just earning 90,000 to 200,000, but right now it's millions. So we need to have that training so we can sustain. And then at that time, they're asking for all the support, like the improvement of the area, even the labor cost if they will um, do something with their facility. Pero this time around, because they have the money, they are capable, they have that skills on their own. Nagsha-shell out na sila. And I want to share this that there's another people's organization that we are forming right now. Actually, by next year, early of next year, we will launch the Lulugayan Falls. So, ang nagtuturo na sa kanila ngayon, yung isang PO who is a grand winner for the best community-based tourism under Ato Pearl
Yung
Award,
torpedo.
the Torpedo. So, kumbaga, na-empower na sila and they're sharing. Nagra-reject sila.
Governor, I was also there during I think two of your core team meetings, and I saw that some of your people's organizations are members of your core team.
Yes, because we want them to be part of our core group. We want them to somehow appreciate what we're doing and somehow makakontribute sila dun sa kung ano pa yung mga kailangan because yung makakasabi lang kung ano yung dapat para sa kanila is yung mismong mga tao who is involved with that program.
Anong number one learning mo, Governor, sa co-creation side?
Actually, kanina, Doc Tim, I thought the question na sinabi mo about listening, pinapatamaan mo ako. Because before, I don't have this, siguro wala ako dun sa yung aspect na good listener. Because, we are in a family, especially in a Chinese family, with a strong matriarch, the personality of our matriarch is very strong. Hindi pwede yung magsasalita ka. You just have to follow. So, at that time, sabi ni Kong Kalin, ako yung governor eh. Ako dapat ang masusunod. But it end up, I get irritated always. Kasi pag hindi nasunod, ano na naman to, mali na naman to. But when we started coming up with a core group, and I started listening sa kanila, then I felt it's easier na pala. Yung burden is lighter. So sabi ko, okay, may times na sinasabi ko na sa core group, you decide na. Kung ano, then I will just, kumbaga, I'll just accept it if we will weigh in kung okay na. And then if majority approves it, okay na sa akin yun. How much is the budget? Before, we used to, pag governor kasi, sasabihin mo, may 10 million lang ako dyan. But right now, what do you want for this budget? How we will do with this budget? We have, like for example, sabihin natin, our ERA right now is 1.4 billion. So, anong plano nyo after sa 45% PS? Ano ang gusto natin? Saan tayo na direction? So, the core group really function well.
Before we go to before we end co-creation and we go to the plenary questions if there are, Governor Daisy, ano yung single biggest learning mo doon sa iyong sitio by sitio convergence program? Kasi sitio by sitio yung movement mo ng development.
Um, First, that it's very satisfying because you see the transformation in the lives of your people. Actual na pagbabago. Second, you're going to learn that if you ask from them, akala ko kasi, pag umupo ako, tinanong ko to, baka pera na naman ang hingi nito. Diyos ko, pera na naman. Alam mo, I was so surprised nung sinabi lang na, Gov, di ba namimigay kayo ng water sealed bowl doon? Pwede ba kami din? Kasi gusto rin namin safe, clean at saka safe sa ano. Tapos kung pwede ba yung tubig, hindi kami inabot, pwede ba abutin din kami? Kasi hindi naman kaya namin. Tapos yung daan gov, sinisemento mo na, maabot ba yan dito sa amin? So pwede bang ganito na lang na daan, wag ka nang gumawa ng malaki? yung lang kaya lang ng mga tricycle or habal-habal, hindi naman namin kailangan ng malapad, no? Then sinabi nila na, Gov, may namimigay palang province ng coconut. Yung farm namin diyan, pwede sa coconut at kape. So, imagine mo 4,700 na coconut na patanim namin, wala kaming gastos, bigas lang, no? So I learned na pag tinanong mo pala sila at a very small amount of money, hindi yung millions na feeling mo. Alam mo, una pa lang hiningi sa akin, school. I opened an elementary school there. Kasi tingnan mo yung mga bata namin, ganito kalaki, grade 1 na kasi merong yung stunting na problema sa Tiboli because siguro intermarrying tapos lack of nutrition, stunting. Eh ganito na, ang layo-layo ng school. So when I opened it, hanggang grade 6 na ako ngayon, can you imagine 450 school children are in school that were not in school before? See? So you cannot imagine bakit yung eskwelahan ko ay isang barangay ko walang kakwenta-kwentang leadership. Kasi yung barangay ko kapitan pala ano lang naka ganito lang pag pumirma, marunong lang ng pangalan pero the rest hindi, 'di ba? Grade 3 lang yung pinakamataas. Eh bakit ang daming school yung pala malayo ang school? So ang learning ko ganito, don't be afraid to ask and to listen because sometimes there are better ideas that are more practical and less expensive.
Thank you very much, Governor Daisy. A round of applause to all our governors. I think we can entertain one or two questions from the plenary. Let's see with the time that we have. Anyone? Yes, please. Please state your name, your affiliation, and direct your questions to the governors.
Thank you. Thank you for the presentations. I'm Gabi Lopez. I'm an urban planner, but I'm involved in a lot of development activities, including Rise Against Hunger. I am particularly interested from all of you how you deal with contrarians, those who oppose you or those who don't like the program. How do you get them over to your side?
For me, with healthcare, it's hard to find an opposition to healthcare service delivery. Everybody wants good healthcare public service in our local communities. So I don't think that's why this is actually an easy divide. Honestly, an easy divide because who would say no to good and quality healthcare services?
Share that. Yung pinaka-unifying na issue is about health.
Yes, I always say that good health system is good politics. So everybody accepts it. Because when I say to our mayors that, if you provide good health services, this will be good politics for you also. So I think I agree with Congressman Khalid here that it's seldom that you see an opposition to this kind of program.
Excuse me, sandali ma'am. Just an aside to Governor. I hope you remember we provided you a partnerships for the poor mobile clinic sometime by President Erap. And we hope it's still there.
It's good that you mentioned that, Mr. Lopez, because that mobile clinic is still working. And we actually developed a program which we called Gobyerno sa Barrio with that mobile clinic as the core, bringing health services to our far-flung barangays. So it's still working.
Sa akin, yung regarding sa kalaban, because our province is very highly politicized. So even if it's for the common good, meron pa rin kakalaban. So ang sabi ko lang, when we meet with the mayors, nandun lahat sila kalaban at saka kakampi ko. So sabi ko, okay, ganito na lang. Kwentas claras tayo, sabi ko. If you are not with me, then you are against me. Now, if that is the case, I will give you the chance. I will offer something that can help with a symbiotic relationship. Even, wag natin pag-usapan ng politika ngayon kasi wala pang eleksyon. So magtrabaho muna tayo. Now, if in the event na you will not support the health program that I'm having, then gumawa ka ng sarili mo kasi sisirain kita. Because I will compete your RHU, definitely. So right now, I will not mention what area, but I'm competing with the RHU right now. Before, makikisuyo muna ako, goodwill muna. Pwede bang mag-ayos tayo? Pwede bang, para hindi ako mahirapan, and you will not be also, mahirapan, symbiotic relationship. We will not talk about politics. I will respect your decision as far as politics is concerned. But for health aspect, can we be friends? Pero syempre merong, no, I don't want to support the province. If you don't want to support, then I will be your headache. Because I will compete with you. And I'll show you this is how health should be treated.
Can I add, since I see a representative from DOH here, my number one opposition is always DOH. Well, naturally, if you understand the history of our provincial or local hospitals, it emanates from DOH. Before our provincial hospitals were devolved, there were some, what's the better word for old, old guards that are there that during the time of devolution, and keep comparing what DOH is getting and what the local government is providing. If there's any opposition or friction, I would say it's that. But naturally, local government, we have our budgetary limitations. And it's a matter of either us catching up or us getting the proper subsidy or support from the national government. Oh, well, we're a political dynasty, so just kidding. Now, to deal with the friction, to deal with the friction, one is I really amped up to the challenge. I think if I'm not mistaken, our starting rate for doctors was 20,000 a month, something like that. We went all the way up to 60,000 a month. So whatever DOH was paying, we're going to pay also because we want quality healthcare service providers. Nurses, we pay more for nurses than the private hospitals do in Iligan City, and that all is part of the financial system of the hospitals. Everything's properly documented, etc. So they actually provide us a standard for us in the local government to reach, and it's doable.
Ako, yung conflict, alam mo, we only have 3 years to show ourselves worthy of another election. So it's a waste of time fighting with them. So ako very fortunate ako kasi napakatagal na panahon na hindi kami binibigyan ng pera ng region namin. Yung mga doctors ko, maraming kwento. Di syempre ikaw na gobernador, nagagalit ka rin. Pero nung umupo na kami, may mali din pala kami. So inayos ko. So ngayon nagfo-flow na. Kailangan lang ang learn ko is, pakinggan mo siya, bakit siya nagagalit sa'yo. Diba? Kasi minsan may punto din naman, wag yung parang palagi na lang, ikaw ang tama, sila ang mali. Baka may mali din naman. But I learned all these years that we have to maximize what we can get. And the best is for us to work together. May problema kami sa Central DOH. Kasi sabihin nila, ay wag na kayong bumili ng mamahaling ekwipo, kami na. 3 taon na, hindi pa rin bumabagsak. Sabi ko, tanungin mo nga, bibigay pa ba yan o hindi? Kaya bibili na lang tayo kung wala tayong pera kasi kailangan natin. Kami kasing local, ang politiko, walang luxury of time. The career has the luxury of time. You have to be 65 before you are going to be kicked out compulsorily. Kami every 3 years has to renew. So yun lang ang gusto namin minsan na i-share nyo naman yung urgency namin. Pag sinabi nyo patayuan nyo kami ng building, patayo nyo na ngayon. Pag sinabi nyo yung CT scan inyo, ibigay nyo na kaagad. Kung hindi, sabihin nyo na para maghanap kami ng pera. Kasi pag eleksyon sinabi, ba't in-announce mo yung CT scan? Bakit hanggang ngayon wala pa naman? So yun ang conflict, di ba? So, pero yung region namin, mga mayors, wala ka nang magawa eh. Pag kaaway mo, kaaway mo. Ako ang ginagawa ko, pagkaaway kita, pupunuin kita. O sige, hospital mo, galit ka sa akin, bibigyan ko ng 1 milyon na subsidy. Bibigyan ko ng health center, bahay ni nanay, etc. Eh pag minura mo ako dun sa town mo, sasabihin ko lang naman na, ewan ko kay Mayor, lahat naman binigay ko, ayaw niya pa rin. Di ba? Ganon yun, no? Oh. So,
I think we have more one just one time for just one more question.
Thank you so much. It's been so interesting. I think I probably speak for all my colleagues from Synergos, hearing the the nitty gritty of how you went about doing this. And I imagine that as governors, you're too busy to stay for tomorrow when my colleagues from Mexico and Ethiopia and Brazil and also from Bangladesh are going to comment. But so I'll just make one general comment that I learned, especially from what all of you were saying. First of all, I think the Philippines is a very special place and particularly appropriate for this theme of bridging leadership. There's something about the culture, including the openness and the humor, which goes a long way. And those are both important factors for the building of trust, which you gave wonderful examples of how important it is to build trust across both vertical and horizontal levels. So I was really listening carefully to those examples. And then the other thing is how complicated it is for those, particularly in the national government. I heard what you were just saying about the Department of Health, nationally, and how you're in the provinces, so you're actually on the ground doing it. And at the federal level, they're a little bit removed. I think probably Abera will have interesting things to say from Ethiopia, where he was working with the agriculture sector, initially with the federal government, and then when they became more open to bridging leadership down to the more regional levels. So this was, for us and our learning in where we're working in other parts of the world, a tremendous contribution, and thank you so much.
Thank you. So it wasn't a question. So it's time. So let, let round of applause for our governors. And let me turn you back to Mr. Ricky.
Hold your horses. Thank you to our beloved governors. What a wonderful experience. I was supposed to announce this later on this afternoon, but actually the chair and the founder of Synergos, the one who crafted the Bridging Leadership Program, is here, and she was the last one who commented, Miss Peggy Delaney. And I'm going to announce her team now that they're here. The CEO, the new CEO of Synergos, Mr. Henry Van Egan, is also here, sir. He's here. We have our representative from Mexico, Mr. Manuel Garza Fishburne's here. And we have Brazil, no, Miss Wanda Engels here. We also have Ethiopia. We have Mr. Abera. It's over here. And from Bangladesh, no, we have, I hope I get right, Mr. Obaidul and Miss Esha Hussein. So you'll be seeing them hopefully tomorrow, no? But they'll be joining us the whole afternoon. So please. Just to announce the session.
The session for the bureaucracy is here. So those who are staying for the bureaucracy, please stay here. And can we invite Professor Nieves, Confisor, to come here to start the session? So we don't picture with Peggy, okay. Yeah. And Henry, yeah. After the picture taking, the bureaucracy discussion will start here. Can we invite Nieves, Confisor, to come over? And security is at 2 o'clock. So can we invite the panelists for the bureaucracy to come here? Secretary Myra, Yusek Milo, and yes, no, for the dito yung ano. And Asek Dumama to please join us here. And Nieves is on her way. No, Secretary, dito, diyan ganyan. Kasi may mga presentations kayo, di ba? Ah, wala na daw. Ah, okay, okay. Dito sa side para ano. Oo. Nieves. Saan si Nieves? Ah, okay, can we invite everyone to please settle in for the discussion on the bureaucracy? The discussion on the mayors is on the other side. And may I introduce the moderator of this session, uh, s- a professor who's been teaching bridging leadership in AIM. Many of you know her, Professor Nieves Confisor, who also had done her stint in government as the Minister for Labor. So can we have everyone settle down first? And I'll be giving the mic to, yes, I'll be giving the mic to Nieves. And yes, okay, so Nieves, take it away.
Thank you very much. Okay, come in, come in. Settle down. Hi, Edwin. Come on. All right, this panel will run for about an hour. All right, and it will focus on. Yes? You're talking to me? All right. It will focus on the use or the bridging leadership as a process for undertaking reforms in the bureaucracy called government. And one of the most difficult places to have bridging is in the bureaucracy. And yet, it is where it is needed most, and a lot of our work has been with government and security forces as well. For this session, we're going to have our questions is what were your challenges, how you did it, and what are some more of the challenges because the frame is only good as we live it. And every year, we do learn some more from those who practice it, and we set up our toolkits for, for the frame. So we have for today, under Secretary Camilo Gudmalin of the BFLP program, he was our fellow. Today he is with the DSWD as he was before, and he's part of the stalwarts that has reformed the DSWD. A good part of it was with Secretary Dinky. And he's also Deputy National Program Director for the PPP, Pantawid Pamilyang Pilipino Program, a program that has gained traction and is now ready for and is actually being assessed. He is a licensed civil engineer, thank God, doing work in social work. So there is a future for engineers. All right. For social, now he's in social engineering. All right. The next one who's going to be with us is Secretary Myra Mangkabong. Ooh, that's a new last name. She has also moved in life. I knew her as a Myra of another. All right, family name. All right, and I really welcome her because Secretary Myra is with the ARM and serves as the Regional Secretary for the Department of Science and Technology. So the engineer is in Department of Social Work, and my social worker is in the Department of Science and Technology. Truly bridging at its best. All right, so she is a teacher by profession, is a graduate of secondary education major in general science. She also heads the ARM, Halal Industry Development Interagency Technical Working Group, as its chair. Our third panelist, our discussant, is ASEC. ASEC Abdullah Dumama, whom I met out there, also with the BLFP. BLFP, for those who are not with us, was our program in Mindanao as well. The first few fellows that we had in the when the BL frame was truly being practiced and analyzed and redone and built. ASEC Abdullah is the ASEC of Health. He oversees the implementation of the Philippine Health Agenda among 9 DOH regional offices, including the ARM. Is that right? As well as the DOH hospitals, sanitary and treatment, rehabilitation centers in Visayas and Mindanao. He is a distinguished alumnus in community service for transformational leadership in public health. So what we have in this panel is our three sectors that are being represented and the kind of work that we need in terms of, so how did they try to reform? Please take note that the topic is how they tried to reform. And it is a work in progress. So let's do this. Let me call on them first, and then we will have the conversation, questions, and also, as in the previous session, many of you are really practitioners and have also been challenged by your own attempts to transform this government, given several precedents you may or may not like. All right? But we need to go on. So the civil service is really critical in terms of making sure that the mainstream or the backbone of this country continues to develop. So let me call on Yusek Gudmalin, Camilo.
Thank you very much, Madam. Good afternoon. The question was, what are the challenges of a bureaucrats transforming a bureaucracy? I think we'll start with a certain background of what these challenges are. Number one, the Department of Social Welfare and Development was created in 1951. So we consider this organization as a baby boomers. And the characteristic of a baby boomers is that they are disciplined, but also stubborn. They believe that the past is better than the future. No, that the things they did before is better than what is being made now. Secondly, the bureaucracy which we are working are bureaucracies that is being driven by rules. No? We work through guidelines, procedures, and we were reminded that in our works we have to follow auditing and accounting rules. So these are the framework by which the bureaucracy operates. When you combine a baby boomer's characteristic and that of the bureaucracy, you have a very big challenge in transforming it. The behavior, there's a human and organizational behavior that is put in place in us, and we were tasked, to manage this bureaucracy to be able to drive innovations in how we deliver services to our respective clients. This WD is being mandated to deliver services to the poorest of the poor, the vulnerables, and the disadvantaged groups. not only the poor, but the poorest of the poor. So that makes the, the, the challenge more difficult. The major characteristic of a bureaucracy is that number one, we need to conform to existing policies, conformity to policies. Number two, it is a structure organizations that has preference to continuity, no, not on innovations, not on change. No, it loves to do something based on the status quo. Number three, by by following the rules and regulations strictly, the behavior becomes losing some what we call the self assertions. You cannot make an assertions when somebody superior will say, "This is what we are going to do." No, mahirap ka na magsabi na hindi pwede yan. No? Kasi the boss already said it that that is how it should be done. And number four, the bureaucracy is politically supportive. When there is a change of administrations, when the policy is changed, the bureaucracy follows because that's the way it should be. So, given this backdrop, this is the backdrop of the environment that we are working. Me as the undersecretary for operations will have to work it out and understand clearly what are the challenges that we encountered and how do we manage them. My journey on bridging leadership started in 2008. You know, when I joined cohort number 3 for bridging leadership fellow at the Asian Institute of Management, and we follow the frameworks. In DSWD, it's easy to do an ownership because we belong to a caring organization. No? So, madali. Sabi nila kanina na, in the bureaucracy, people operates without a heart. No, in DSWD, we operate with the heart. Always with the heart. Oh, so it's not a problem as regards to owning the issue as regards to the poverty that we need to address. The co-ownership is not also much of a problem, but the problems will be on how we're going to innovate to be able to deliver efficient and effective programs. When I was assigned as the undersecretary for operations, a challenge came when we have major programs in the department. We have the conditional cash transfer, we have the community-driven development programs, and we have the sustainable livelihood programs that comprises about 80% of the total budget of the department. And the challenge was we need to improve the well-being of our beneficiaries, numbering to about 4.4 million households. We understand that no one programs will be able to solve the issue on poverty. We need to converge a lot of programs to be able to address the different factors of poverty, and that is what we did in the SWT. But our programs, the Kalay Seeds, the Pantawid, and SLP, were born at different in different years. Kalay Seeds was started in 2003. Kalay Pantawid Pamilya was started in 2007, and then SLP was started in 2011. They have different guidelines, and more often than that, when our workers implement the program, they follow the guidelines. We have what we call an internal silo in DSWD among our programs, and the challenge is how do we bring them together to be able to arrive at the same results, which is the improvement of the well-being of our beneficiaries. So the first thing that I did was to create our core groups, people who believe that this is this is the correct thing that we need to do, which is to converge our three core social protection programs. And after that, we conducted series of training, for our first with our core groups, and then next with our regional directors. No? The regional directors is very crucial because they are the one that is driving and steering the implementations of programs in the field. And then after that, we engage the people in the ground, including our beneficiaries. But we go there not just imposing to them what are the programs that we need to implement, but we start by consulting, listening to the people, what their needs are, and how best the SWD can help them. We conducted a lot of assessment and review of the programs that we prepared, of the programs that we implemented, and we do adjustment along the way. In the words of our former secretary, Dinky Suleiman, said that we reform while we perform. So we continue on implementing. As we have seen, there are different peculiarities in every regions. We cannot just apply one guidelines for all. So we need to innovate as we implement our programs depending on the situations occurring on the field. But the core group is not enough. No, we really have to scale up the applications of the bridging leadership framework, and we conducted trainings together with our academic partners. No? We are thankful to Swilig Family Foundations for introducing us to our with their academic partners, and then we launched what we call the Leadership for Convergence program. We started with our workers who are implementing the programs in the municipality levels. We graduated more than 2,000 of them within a training that lasted for 8 months. They have what we call the training application, training applications, until that they're able to complete the whole programs for leadership for convergence. Then after that, we believe that the SWD alone will not be able to implement the programs effectively if we will not also involve or given appreciations to the bridging leadership, our partners in the local governments. So we also include trainings, especially the provincial social welfare development officers, including the planning officers of the province, for them to properly understand the directions of the programs that we implement in their respective areas. And as we speak, we have graduated already about 297 provincial social welfare officers and PPDOs in the country. We will continue to implement these programs, and we are evaluating the results. And in 2015, when we started in 2008, based on our social welfare and development indicator assessments and the listahanan, or what we call the national household targeting systems for poverty reductions, out of 4.4 million households that we assessed, 1.3 million of them are now considered non-poor. As claimed by Professor Garilao, we cannot make a causal relationship as to these claims, but there are changes that happen among our Pantawid Pamilya beneficiaries. And for me, as leading the implementations of convergence, we say that perhaps this change happened because our people in the field knows the inequities, and they address them, and the people, especially our clients, also received these programs and cooperated making their well-being now improve. Thank you.
Secretary Myra.
Assalamualaikum warahmatullahi ta'ala wabarakatuh. I am Myra Borja Mangkabong. Yes, I just switched name now to Mangkabong. I'm the Regional Secretary of the Department of Science and Technology. So I'd like to tell a story, my journey as DOST Secretary and as member of the economic cluster of the Hataman administration. So I belong to the MBLP2 batch of the AIM Bridging Leadership Program together with Jihan and Ate Tess here. And I think they're also with me because they belong to the bureaucracy of ARM now. If you look at ARM, the ARM itself is a big social divide. Considering the statistics, ARM is the poorest. Nandun na lahat sa amin. Kami yung top pero on the negative aspect, no? Kaming pinakamahirap, maraming namamatay sa amin, maternal mortality, kami yung pinakamataas ng malnutrition, kami in terms of literacy, kami yung mababa, lahat na yata first honor kami doon, no? So the ARM itself is a big societal divide. So when I graduated from MBLP, that was the time Governor Mujib Hataman was appointed as the regional governor of ARMM. He was just appointed during the time of our president Benigno Aquino. No? So he tried to get people, the right people, to sit on the government na magiging part ng cabinet niya. And we were so lucky that most of us actually na nag-graduate sa MBLP2 are part of the cabinet of RG Hataman. I just don't know how did he pick it, but we went to screening. It was not just handpicked. So Jihan was the Department of Tourism secretary. At the time was with DTI and Agriculture. So we were all actually sitting there. But well, it may sounds good. But on the other hand, on the first day of our job, we find in big limbo because the office that we're getting into is not a haven of peace. It's not even a garden of Eden. It was a garden of thorns that we don't know when will the roses blooms. So I will zoom it to the Department of Science and Technology. 1BL, si Sir Malang is here. He was formerly the Executive Secretary of ARMM. ES po siya. Before he became the Secretary of DTI, ES po siya. And then, before I became the Secretary, he was the ES. He even proposed to Regional Governor Mujib Hataman, I'm sorry, pagalitan ako ng boss ko, to abolish DOST coming from a BL. Sabi niya, buti pa, tanggalin na lang yan DOST, wala namang ginagawa yan. Coming from a BL. So I was out of the picture then that time. So uh, I I asked Hataman, Governor Hataman, pwede ba sir, ibigay mo na lang sa akin yung dating ahensya na hinahawakan ko, which is DOLE, because I started it well already there. Or can you give me another agency wherein pwede akong mag-excel? Sabi niya, no. Kasi bridging leader ka nga you should be at an agency na half of the white hairs na meron ako ngayon is caused by that agency. So, I was placed in that agency. I want you to imagine, wala akong presentation, I want you to imagine that our office is, wala akong opisina. Yung opisina ko, kailangan kong mag-create ng cubicle sa loob ng laboratory room namin. So, and then our staff goes to the office at 10 a.m. Before 8 o'clock, nasa office na ako. Pero yung buong staff namin, to include janitor, 10 o'clock. So, I was waiting for them there. So, and they go home at 3 o'clock. Ako, I go home at 5 o'clock. So, this persists for around 2 to 3 weeks. So, mahirap yon. On my part, it's a big challenge. First and foremost, half of the populace of DOST ARM are actually twice my age that time. I was just around 38 or 39 years old. And my subordinates are already uh, creating mushrooms in their tables. Ganun na sila katanda, no? Ganun so. So, when I get into DOST, we were known as the Department of Suka and Toyo. Okay. So literally that's DOST, Suka and Toyo. Okay. So why? Because the only program that we know or the only thing that we know there is to give trainings on how to make vinegar and how to make soy sauce. That's it. No more, no less. That's the reason why ES Malang before was asking RG to abolish DOSTR. So it's very difficult because half of my subordinates are older than me and we are belonging to the different cultures. I'm the only Yakan are minority in the ARMM. So pag Yakan ka, medyo hindi ka ganon ka affluent because you belong to the minority. Most of my subordinates are actually in the majority clan. And they're in the majority tribe. They're Maguindanao, they're Maranawans, a little of Tausug, not much of Sama, but mostly of Iranun and Maguindanaoan. And these people are bragging that they know better than me. So here comes their a boss coming from an MBLP graduate, kagagraduate ko lang, mainit-init pa yung experience namin sa MBLP. And a big thing, another challenge is because I'm a lady. In Islam, a man always rule any group. Ako kasi babae ako. Mahirap kang mag-rule kung babae. You have to prove your worth first bago ka bigyan nila ng recognition. So that's very difficult on my part. As if I'm carrying Atlas on my shoulder. Another is, DOST do not have program funds. Our yearly fund is only 25 million. And more than half of the 25 million goes to PS. So, PS lang, salary, and MOE. Walang program fund. Kaya pala, yung isang director namin, nag-submit siya ng report. When I asked all of them to submit the report, on the first day of my assumption to office, ang nilagay niya is watering the plant, sweeping the floor, and scrubbing the floor, no? So it was a big challenge on my part. I need to turn 360 degrees. Hindi lang it's very difficult. So eventually, I asked, maraming kaming ginawa. Marami akong ginawa, but I'm happy that my fellow BLs in the bureaucracy, in the ARMM, are actually helping us din. So, what we did is, I made a recess for 2 weeks. I called them for a retreat. Retreat. Sabi ko, bakasyon tayo. We do a lot of sensing. We do a lot of self-evaluation as to where we are and what is our worth and what is harm for us. Because we're not just serving people, we're serving our very own people. So if we're not going to move, we might not be called a public servant. Kasi kami yung, and then what is common, I think even to all other line agency, they only report every 15 and 30. Perfect attendance every 15 and 30. O yun po. So I need to take that advantage that I started our retreat on the 15th. And I gave the salary during the retreat so that all of them will be there. And the first thing that I do is to remove my name as regional secretary. I need to step down to them and to sense bakit sila ganon. Because they were product of previous practices that were never corrected. They were product of a cycle in the past na walang they were tolerated but walang nagko-correct because they thought it's okay. Anyway, this is government fund. That's not your fund. This is even if we're absent, we're being paid. So parang ganun yung concept nila noon. So during the retreat, we do a lot of sensing. Yung scorecard and everything, ginamit ko na. Medyo, we went deep dive. I was just thinking, tinitingnan ko doon si Prof. Nieves, baka naman ito pag deep dive namin, hindi na kami aahon nito. Sabi ko, sa sobrang dami ng problema ng DOST ARM. We were only 32 in plantilla position. All over ARM, 32 lang kami. Yet, one department kami. Yang 32 kasama na yung provinces. Ganon kami kaliit. So, kung meron kaming gagawing changes, parang hindi na-feel ng iba. Kaya nga sabi ni Sek Malang, i-abolish na lang yan. Okay, so yon. So, there, hindi ko tinitingnan kung ano yung, sabi ko sa kanila, yung positive na inquiry nga sa kanila, Prof. Canapi, no? Ano yung maganda sa kanila? Yeah, look at what we can do. Look at our possibility, ano yung strength natin. Never mind the weakness muna. Ano kayang magaling sa inyo? Ano yung maganda sa atin? Let's share. Let's do things and etc. For 2 weeks, we were looking at who we are. So some of them were saying, alam mo Sek, sabi niya, marami ng secretary dito sa amin but hindi pwede kaming diktahan kasi alam mo, we came from a royal family, mga royal true orange ba, na ano. So you know, they were telling me we are untouchables. So that's very difficult. So what I did is to step down. Sabi ko sa kanila, can you also step down? Let us forget that we are royals. Kasi ako, hindi ako royal, true orange lang ako. So can we step down? Because RG Hataman's flagship program is on reform. That's his stalling order. Reform, ARMM. So yun po. So what we did is we sat down together and I look at their gains. Ano yung gusto nila and ano yung pwedeng makontribute nila sa DOST arm. So eventually it was not a magic. It evolves little by little. So from ownership, we transcend to co-ownership, but it took a lot of time and effort, a lot of cries, a lot of pains. There were even some of my staff who doesn't want to be placed in the province. Yung trabaho niya sa probinsya, pero nasa region siya. Ang ginagawa niya yung trabaho ng region. Ayaw niyang pumunta ng probinsya. But hindi naman with an iron hand, but I find ways for them to go back to the province because their position is for the province. No? So eventually, it is not a fairy tale story. Ano siya? Parang Harry Potter din na marami siyang pinagdaanan na hirap na monster along the way. So yun po. And from 80,000 na local fund, meron kami. 80,000 local fund. Meron kami. What will you do with that, isn't it? With 25 million from DBM for a month. So, it's a big struggle on our part. Because of my MBLP na yung sabi nga ni Prof. Neves, network. So, we did not focus on government. I look on partners. Ano yung meron kami? And ano yung meron na mga partners namin? So, we go down. We go down to the communities. We reach out even to the unreachable part of ARMM. When I say unreachable, these are conflict-prone areas or yung area talaga na kailangan mo pa ng isang linggo bago ka makarating. When I send email to Tawi-Tawi, una pa ako dumating kesa sa email ko. So literally, malaking balakid yon sa amin. So what we did was, I introduced BL. My staff become BLs along the way. But it did not happen over time. So when they appreciate their work because we started to touch lives. Noon kami, tinanggal ko na yung training lang. Sabi ko, we upgrade. We tend to move forward by upgrading. Ano ba yung meron tayo? By creating innovations. So instead of training, we look into the SMEs kasi sila yung direct client namin on techno-transfer. Noon, wala kaming techno-transfer. Yung techno-transfer namin is training lang. And we go beyond that. No, ang DOST, one of the flagship programs of DOST is research. But for the past 25 years, DOST had not done any research. Imagine, flagship namin yun. And another thing, ang DOST is, akala nila scholar lang. Pang scholar lang yan. Actually, hindi. Ang laki ng mandate ng DOST na kung tutuusin, we cut across all sectors. Kung disaster, nandun pa rin ng DOST. There was even one question asked by a community in Maguindanao. Sek Myra, you were able to come up with all these devices to determine kung meron ba tayong ulan, may bagyo ba, etc. Can you invent an instrument that will tell kung malapit na ang gera o hindi? So imagine, no? They have that high expectations on us. Eventually, through pain, wala kasing gain kung walang pain eh. So, eventually, when we started doing the framework, although we make innovations in a way that it will be culturally fitted to us. This, before we end ARMM, we're going to face BARM probably by January. We're very, very proud of our agency because we're not just moving onward, we are actually a multi-awarded agency now. So, yes, we are a Grand Slam Red Orchid awardee. Grand Slam. Pag sabing Grand Slam, 3 years consistent. Red Orchid awardee kami. And there are only two in the ARMM, RPDO and DOST, or Grand Slam on that. We also received the Silver Anvil Award from the DOST National for reaching the different areas of ARMM and delivering the electronic Starbook, the e-Starbook to every communities in the ARMM. Kahit walang electricity, binigyan pa rin namin ng Starbook. And another award that we received, which I will treasure most, is coming from my boss himself for recognizing the OST no longer a Suka and Toyo department, but a promising department of ARMM. Yun po.
Thanks, Myra. I think we underestimate when we want to change the bureaucracy. It's not really just reform, it's really transforming. And that's where a lot of the work is going to be brought by these three persons. The third one is Asek Dumama from the Department of Health.
Yeah, Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good afternoon, everyone. I just want to thank the organizers for inviting us here and share our precious journey stories. Let me start by saying I belong to the BL program for societal divides, cohort 2. Medyo nauna pala ako sa iyo, sir. Medyo senior akong konti. Yeah, that was 2007 until 2009 in AIM. Pardon me if I glance once in a while dito sa aking notes kasi I was told I would only react pero may present pala kami. But that's okay. I started facing BL in 2007 when I was the regional director of Department of Health in Soxargen, that's Region 12. And the societal divide, the divide that I saw there is quite a bit easy, but I find it relevant. Choosing among the divides, there are so many divides actually. Si Sec Myra already has mentioned, pero kinuha ko yung of the inconsistency of belief and action among the local chief executive. Pardon me for yung mga local chief executives here. Pero 2007 pa naman yon. I hope somehow they have already transformed. And why did I say that? Because there was a high maternal mortality rate in the area. Low FIC, the fully immunized children, that causes sporadic outbreak every now and then from areas where there's low coverage of immunization. Also, emergence of infectious diseases. We see cholera, we see malaria all over during the time, and we need to somehow address that. Until also as far as maternal mortality rate is concerned, as I said, it's very high, and this is due to probably low facility-based deliveries, low skilled birth attendants deliveries, and then so that. Oh, by the way, my journey is divided into 3 actually, but I will just make it fast kasi gutom na rin din talaga ako actually. And then, first the journey was when I was in Region 12. Yun na nga ho that was the divide that I chose. And then, as the regional director, I have to make a personal response. I need to look around and look for an avenue to make sure that the solution to the problem is just around. And I saw a very good avenue, which is the interlocal health zone. Interlocal health zone, if for for those who are new to this, is defined to be any form of organized arrangements for coordinating the operations of an array of hierarchy of health facilities. Ito ho yung ano, it's this pooling of funds, resources, all everything identify, and then this is consists of uh, adjacent municipalities in one province. So I chose Bites. Bites is means Babumbayan, Isulan, Takurong, Esperanza, and Senator Ninoy. To prove to you that it has been successful now, the speaker there outside, the speaker on the other end is Takurong Mayor Lina Molina, and and then she's a proud BL actually. Now yes, she's been harvesting the fruits that he uh, planted. Anyway, as soon as I got bites involved, uh, I make sure that I have to attend the local health board meetings. I make sure that bites meeting will be regular. I make sure that topics and agenda should be organized. I make sure that all of this will be in a form wherein it's supposed to be addressing all problems involved, especially the budget allocation for health. Uh, we found out that it's during the time it's kind of low. It's about lower than the 15%. It's not required, but it's the ideal percentage of budget allocation for health in one area. And then, well, as far as co-creation is concerned, we saw that there was an increased PHIC claims already. No, in fact, if you won't believe it, because one municipality that is in Bagumbayan is earning 6 million a month, 6 million a year that time, and in fact, the mayor was telling me that the how successful the the PHIC claims of this one municipality. She said, you know what? The doctor told me na baka kailangan nyo ng sasakyan, we will buy for you. You see? Binabilhan pa nila ng sasakyan yung mayor until the mayor said, no, I don't have a driver. I will provide a driver for you. You know what I mean? Because of the, ang ganda-ganda na nung arrangement. The health service delivery has really improved a lot. Facility-based deliveries, skilled birth attendants were high already. And of course, that always goes to show that our health outcomes has really improved. I will proceed to the second phase of my journey, in which I was transferred to regional office in Davao Region 11. That's in 2012, and then my journey didn't stop in Region 12, so I continued it. No, we went to the HLGP Cycle 1, wherein change management program of the ZFF was introduced to us. Until then, the maternal mortality rate of Davao again is the highest among the regions in the country. That was a little over 200, and that's alarming already. And then, because of the sense of urgency that I thought should be addressed, I created a coalition. What's this? A guiding coalition. I call it Team D. It's not Team Dumama. It's not even Team Duterte. It's Team Davao. And then I invited external and internal stakeholders, including the military, the police, even the DSWD people in the area were invited to come and join, the local government officials, and ano pa ba yun? Even the media, well, ABS-CBN and GMA7 was invited to join. And then, well, it has really improved a lot. We were able to go down to the level of the barangay, no? Even if you go to Davao, I can assure you, if you go to Davao, you ask for Team D in barangay, there are Team Ds in the barangays. And one very good example here is the I don't know the enthusiasm of and the I don't know participation of our good governor of Compostela Valley, who made sure that Governor Tyrone his even ganyan sa kabata, makinig ka naman, Governor. Anyway, and then and then uh, that means yung ating coalition was not only limited to health, no, lahat-lahat. Oh. And then the third ano tawag nito? The third phase was when I was appointed as Assistant Secretary of Health for Visayas and Mindanao. Until then, we make sure that cluster meetings are happening. We monitor and evaluate programs of all regions, 9 regions in Visayas and Mindanao. We made sure that SDNs in all areas are service delivery networks, by the way, are functional. The quality management system is sustained, and now the secretary is asking for PGS accreditation in the hospitals. Yung third po yun, no? I can feel that there's one more phase that I need to cross the BOL is coming. So maybe this is another journey again that I will be facing, so that you know, I may be facing some challenges, but I hope yung challenge na yun is easy but relevant.
All
Thank you
right.
very much.
Thank you very much, Asek Dumama. Thank you very much, Secretary Myra and Camilo. What we have are three persons deeply embedded in a bureaucracy that wants to embed them as well, and they have refused to do so. I'd like to open the floor not only for questions to the three, but also comments, because many of you carry your own scars and your own pains, but also your real good stories, the war stories as they claim. But the three have something very similar, and it's not the bureaucracy that keeps them together. I think what they have, and I thought this must have been opportune, is that they are going to do their BL, address a terrible civil service culture, make it innovate, but the worst part is it's in a conflict area. And all three of them will converge into a perfect storm. So may I now open the floor? Questions, your own war stories, um, comments on what has been presented as to the bureaucracy and how BL has been able to, in a sense, not only reform, but in a sense, transform relationships. Anyone? I will stand up. Yes, please.
Thank you very much. I'm Emmanuel Garza from Mexico, and it's a great privilege to be here today. Thank you very much for the space. So I'm just curious to know, in your experience, what would be the main barriers to scale up the development of bridging leaders within the agencies that you lead currently? I would say that there's a need to get to a certain tipping point within the organizations to really strengthen or foster these kinds of capabilities within the ecosystem of bureaucracy. So I would like to know just what you would find to be the main barriers to get to that tipping point. Thank you very much.
Camilo, you want to start?
In our department, the SWD, we have 4 secretaries in 2 years. So the change in leadership is a major barrier to scaling up, bridging leadership adaptations. Before, we have a very supportive secretaries, and then another secretaries came in, doesn't believe on it, and says that no, we have another strategy. We need another strategy, and then another came in ambivalent about bridging leadership. And that's very important because they are the one driving the direction, the trust and priorities of the department. But we have a new secretaries now. We have a new secretary, and I think we'll be able to influence him to support our initiative and continue what we have started in implementing bridging leadership in delivering programs of the SWT.
Yes, I think as regional secretary of the ARMM, our term is fixed. So unlike these two, whatever storms will come, they will remain. For us in the ARMM, we have a fixed term. We're coterminous. So even if we have that gains now, in fact, the entire ARMM now was saying, we already have that gains. So here comes the BARM. Ano yung mangyayari? What will happen to us? Are we going back to zero? Or are we going to sustain, considering that we'll have new entity in the future? So the problem is sustainability for me personally, as regional secretary, is the sustainability of how to continue this. This is more on the co-creation aspect, wherein it's very difficult for us to sustain our gains, considering of the quick change of government that we have. So that's one. Another is one big problem also as bridging leader, because we are going in the ARMM, we're faced with different facets of divides, that we cannot just focus on one but look into it, all of it at the same time. So I think those are the major barrier that we experience.
Yes, mine is in the Department of Health. I don't think we will be facing some problems because we have lots of bridging leaders already, from the regional directors down to the door reps already. And the only thing that we are doing now is how to be able to institutionalize it, budget, make an office dedicated for HLGP, or Health Leadership Governance Program. I think that's all. That there's no much of a problem, not much of a problem. My challenge, maybe next time, is how to be able to get BARM get involved and ride the same ship towards a same direction.
Okay, wrap up. I'm told. Well, let me say this. Sorry about the time. I think we've been running short on time as well. There is so much experience in the room. Also, the need to converse on some of the issues which was raised in the first question is, while we look at the frame, we also ask ourselves, yeah, what are your barriers in terms of skills? You are facing an ecosystem, as you would have noted, yeah, where it's not only the civil service, but it's a civil service attempting to address in a conflict zone. All right, so in this portion, also, we'd like to wrap up, and many of their points have been, it's so BL, yeah, is that the coalitions, the guiding coalitions, the networks of Myra, how do you survive um, the resistance in a bureaucracy and get over it? And also, we have what we know as the assessment is necessary, as Yusek Camilo keeps saying, although Yusek Camilo must have been in the bureaucracy for the longest time. He does sound like it's been one long uh, program. And in that sense also, oh my God, Camilo. Yeah, 37 years. And he's running one of the youngest innovative programs we have. So please don't look at our civil service as if it cannot perform. It does perform. Right? And now the question is, so how do we get the rest of the civil service to act this way? And it's a major challenge. The BL has helped a lot, not only in the DSWD, the ARM, and the DOH, but we now find footprints of BL. And one of the things we know for a fact is you cannot be just one BL leader. The challenge is to build that critical mass. And so, in this kind of summit, we would also like to be able to connect with each other because the critical mass will have to be born again. And one of the things I thought I'll just share with you, if there's anything about the stories that we have, BL is not linear. It's not ownership, co-ownership, co-creation. It is a cyclical action. One day those three balls are up in the air. One day we say we can't co-create yet, let's move back. And so these stories, especially in the civil service, that story of BL, not linear, but something that we keep moving, and the power is in the way it is activated, is something that is a basic lesson for us in this place. So thank you very much to our three sharers. And thank you also, I'm sure you have your own war stories as well. Thank you.
Good afternoon, everyone. So now we come to the best time in a conference, lunchtime. But we're going to have a working lunch. So this is what's going to happen. This is going to be the final breakout session. We have three breakout sessions. On this side, we'll have the business sector, no, the most neglected sector in the BL practice here. And the other side, you'll have the academic partners. And in the boardroom, you'll have the research. No? And when you go to the boardroom, you don't have to bring your lunch there. They have lunch is going to be served in the boardroom. So you can get your lunch now if you want to attend here and the academic partners. So we have three presenters, which I'm going to introduce once everyone is already here. So can we get our lunch as we prepare for the presentation? Thank you.